families and youth, where to begin and how to find help. I am Dr. Jennifer Brothers with Cook County Health Office of Behavioral Health, and I will be moderating today's conversation. Finding mental health support for a child or a teen can feel overwhelming. Families often face questions of where to start, what types of services exist, when to seek help, and how to navigate barriers to care. Tonight's discussion is focused on helping families better understand available supports, how to navigate systems of care, and where they can turn for help within their communities. Our goal is for this conversation to feel approachable and supportive for parents, caregivers, educators, and anyone supporting youth. I'm incredibly grateful to be joined by an incredible panel of experts tonight, Dr. Judith Allen, Jasmine Watkins, Dr. John Parkhurst, and Nestor Flores. Thank you all for being here and sharing your expertise. To start, I would love for each of you to briefly introduce yourselves, your role, and what you love about the work that you do. We'll start with Jasmine.
All right. Good evening, and thank you so much for having me as part of this important conversation. I'm excited to dive into how we can support our families and help hopefully folks walk away with a little bit of nugget related to where they can go to support their young people. I am the Chief Program Officer at the local Chicago affiliate of the National Alliance on Mental Illness, that is NAMI Chicago. We were founded in 1979 by 4 families who were supporting their kids living with mental health conditions in a time where it was very much stigmatized. Mental health conditions were very stigmatized. So we're really rooted in advocacy, and we support families with getting connected to care. We provide education, peer support services, resource navigation, crisis response, and also really fight to make sure that policy is covering and providing equitable access to care for the system.
Thanks, Jasmine. Dr. Allen? Dr. Allen? Are you able to introduce yourself?
I was thrown there a little bit, Jennifer. I think that Dr. Allen is having a hard time hearing us, so she.
Okay, well then we'll move over to Nestor. Nestor?
And I can hear you.
Yeah.
So I'm Nestor Flores. I'm the Vice President of Behavioral Health and Clinical Services at ADAS McKinley. It's an organization that's been around for over 100 years doing community services. And my role is really to make sure that what we say we're going to do actually gets done, right? So as an executive, it's designing programs and making sure that they're executed. What I like about the role or love about the role is really, I grew up in the south side of Chicago. And so that's where our service area is, our locations. And it's great to give back to sort of the space where that kind of formed me and knowing what the needs are and helping with that.
Thanks, Nestor. Dr. Parkhurst.
Thank you for inviting me for this important conversation. I'm John Parkhurst. I'm a psychologist, child psychologist here at Larry Children's Hospital. I work within the Pritzker Department of Psychiatry and Behavioral Science. But my big work and big role here is working with community pediatricians and behavioral health providers. What I really love about this work is I get to interact with families and pediatricians and schools and all of the network that really gets to work with and be supporting our young people in their trajectory and development. And what I guess I appreciate most is helping families identify that first step or the most important step to really address something that might be a challenge. So thinking about quarterbacking care is certainly something I do on a regular basis, and would love to have a discussion around that. I'm excited about that.
Thank you. Dr. Allen, can you hear us? All right. Well, we will circle back. Hopefully, Dr. Allen's audio is, but we have Dr. Allen from Community Sin School of Chicago. So before we dive into today's discussion, I just really want to encourage everyone joining us today to post questions in the chat. We'll do our best to answer as many questions as possible during our time together. We'll also share all resources mentioned during today's discussion in the chat as we go. And if you missed part of the conversation, or you know someone who may benefit from this conversation, this Facebook Live will remain available on our social media pages for future viewing and sharing. So let's get started. I think one of the biggest challenges for families is simply understanding what support options even exist and what kind of services may be most helpful for their child and family. Dr. Parkhurst, maybe we can start with you, given your experience working in the clinical settings, and then I'd love to hear from others as well. What types of behavioral health services are available for youth and families, and how can families better understand what level of support may be most appropriate for their child?
Sure. Thank you for the question. I think mental health treatment it can be oftentimes very gray for families. Knowing what treatment is right, what the primary concern is. So I'm often coaching families to just start with their trusted care network. Oftentimes that looks like, and I think a lot about pediatricians as being that first step. Pediatricians are usually the individual in the health sector that has probably the best view of what might be available and can also help start to identify what might be the primary concerns for families to address. Certainly schools and other community agencies are great places, but families might not know about some of those agencies. And so I say start oftentimes with a pediatrician. Or a trusted person in the school, because those are two of the likely places that they're going to engage or start to have the conversation around mental health.
Thank you. Mr. Jasmine?
Yeah, I would love to add in. I think certainly, utilizing what's available on social media, so Facebook Live, opportunities like this where resources are shared can be another way to start to gain that information. Our helpline at NAMI Chicago can be a really good start point. We oftentimes say you don't need to know anything except for our phone number to start to learn about what services might be available to you, and our specialists will help to get a sense of what might be going on for your family in this moment, or provide the information for you to tuck away and save for when you may need it later down the road. And I also agree for sure the support folks who might already be in your child's life, whether that is a pediatrician, whether that's a coach, that might be someone in a mentor program that your kiddo is involved in. It's great to see a lot of the non-clinical spaces really starting to embrace and acknowledge the benefit and the importance of mental health and wellness and well-being. And a lot of folks in those spaces are starting to equip themselves with the ability to connect families. The faith community is another big one where people oftentimes find themselves, sometimes families who might not have the same level of trust with the healthcare system, but are able to get to church, and there might be a youth pastor or someone there who can be part of that conversation for your family.
Thank you.
Yeah, you definitely want to have different entry points to care, to behavioral health. So I agree with everything that's been said. I would add that, oftentimes you start on this path of working on your mental health if you've already had a crisis, right? You end up in a hospital or your child has a crisis. ADAS McKinley has mobile crisis response systems 24/7, 365. So, one of our providers could be the first person you meet, and it's usually in this moment where you're the most vulnerable and you're going through the situation. But I also think that mental health is preventive. So you don't have to wait for a crisis to seek the services, to reach out to someone, to a provider, find therapy counseling. We purposely build clinics in the South Side so that you don't have to travel too far. So hopefully there's one nearby. But I think just getting started and really asking for help it takes a lot of courage. And so just having the courage to do that is step one, I think.
Thank you. So it was mentioned that schools and healthcare systems, are some of the first places. That's where some of the concerns first surface. So I would love to talk about, how dive a little bit deeper into how schools and primary, to your point, Dr. Parkhurst, how primary care doctors can support students experiencing mental health challenges, and how you can kind of build that relationship. Parents and caregivers can build those relationships with schools and pediatricians.
Well, I think about, I would imagine most of us get to this work because we're interested in public health, and to Nestor's point, is public wellness. And what happens in mental health is that, as was mentioned, we often wait for crisis. And what I think is important about these care systems is that they're getting better at starting to identify when things are starting to get a little bit off trajectory, if you will. And I think pediatricians do this naturally. They look for patterns. That's what they're built for. And most of our children are going to see a pediatrician within a year, especially at younger ages. It extends out a little bit as children get older and don't have the annual visit. But I see that as like the most common entry point, where the clinician has hopefully some base level understanding of mental health concerns, but is also screening and identifying concerns. And this is what I'm really excited to see starting to happen and increasingly happening in schools. There's a much greater variability in the training that people receive, because you've got many more disciplines within a school setting. But that doesn't mean that there's not a space to start identifying when things are a concern, when things are becoming a concern, and or being willing to go to a trusted individual at that school to kind of identify if there is a concern. So it's both this preventative nature of systems that have screening in place that can start to identify when things are coming off trajectory, if you will. So schools and primary care, certainly my recommendation and suggestion.
Jasmine or Nestor? Any additions?
Well, I just had this thought that we want to make mental health and behavioral health really approachable. So it just like families take their children, youth, or themselves to the doctor, they take them to the dentist. Really going to a behavioral health therapist, provider, it should be that simple and regular, and we could get into like what assessment looks like, and finding someone that you could relate to in a confidential space that feels like a safe space for you to do that. But just normalizing that that's part of your overall health, I think goes a long way.
Yeah.
And all I would add, echoing kind of what has been shared so far, schools in particular are places where it's the primary space kids find themselves in, or that is kind of what is expected. And so is oftentimes where some of those slight differences start to show up, and where maybe additional challenges or the need for additional support is recognized. So I think that's a really strong place, and equipping, our school resources with the ability to connect to resources. Sometimes we rely on them being kind of a behavioral health system in and of themselves, and that's not necessarily how it is designed to operate, but can certainly be part of connecting the family further to supports that might be needed.
That's great. You talk about the connection to schools and the health system, however, some families find navigating those systems and getting connected to care to be challenging, and to find that person to to connect to, or how best to advocate for their child within the school or the healthcare system. So what are some questions that are recommendations you have for parents and caregivers to ask, whether it's their pediatricians or their school counselors or the teachers even, on how to engage and get connected to care? Like how what recommendations do you have for parents and carers in advocating that when they see something, they feel like something's maybe not right, or there's something that I'd like to work on with my child? What advice do you have for them?
Yeah, I can hop in here. I don't know if that was to me or who that was to, but I think certainly, being as a parent, you are kind of the biggest advocate for your child. You're often, you know them the best. And so kind of, knowing that asking questions is always welcomed and encouraged. Thinking about, with your pediatrician checking in around those anxiety and depression screens, knowing that that's an option within our school system, that's going to be, an option here in Illinois. Taking a lot of notes, bringing your own observations, right? And, we've not talked about it yet, but the supports, especially for a child, really are kind of a team-based approach. And so there's going to be a lot of folks who are involved in your child's life. And so as you're at those appointments, taking good notes, bringing those notes, and then using those really to inform the questions that you're asking. And if you're feeling as if you're being dismissed, can appreciate that and know that advocacy can be really exhausting. And just know that kind of keep pushing forward, and you'll have the evidence kind of there at your fingertips to check in. I would also say there's other barriers, right, beyond just how do I know how to advocate? Maybe I have found the right resource, or I'm having a hard time finding the resource. And so there are low barrier, kind of free, confidential resources here in the county, including our helpline, who can support with troubleshooting those barriers. Maybe it's cost and insurance. It might be transportation. I mentioned before, sometimes it is kind of that mistrust of the healthcare system, or finding the culturally responsive resources. All of those, a really good start point can be kind of those lower barrier. Living room can be a good space to go, to be in person with peerless.
Can you tell us what a living room is?
Yeah, absolutely. And, certainly would have Nestor expand, but it is part of our crisis continuum, and can be a place of respite where folks go. They are peer-led. It can be space just to kind of take a break maybe from the day, or if you're feeling, kind of increased or heightened symptoms, can be a place to get some stability and talk with folks or not talk with folks. And you can be there really as long as you kind of feel is needed to become stable.
Thank you. Nestor, Dr. Parkhurst, any other additions?
I mean, I like that you're talking about school and pediatricians. Like, we developed a school-based program at Ada just to have therapists in the schools, because we know the need is there, and they're often the first ones to call our crisis systems. Schools are really reliant on us showing up when there's a crisis. But I also think that there's a lot of students in the school, and sometimes it's the loud ones, for lack of a better word, or the ones that act out to get the attention. But there's also the quiet ones that might be suffering in silence and aren't as vocal and not as easy to spot. And in hospital settings or doctor settings, sometimes the interactions are short, 15 minutes, 20 minutes, and then you may or may not be able to confide. So I think I would tell parents that you need to be ready to tell your story. So that requires some vulnerability, and you need to be ready to get feedback, because chances are that when you finally do identify the provider that you could trust and feel safe with, you're going to get feedback and psychoeducation onto how you could do things differently. And so I think this sort of wellness journey in mental health is a journey. Mm-hmm. And so being prepared for that is important.
Yeah, I like what both of you have said. This idea of coming with the concern and being willing to lead with that and being vulnerable, I think is hugely important. because many parents, I think, we kind of can fluctuate in this, oh, it'll get better, or wait and see approach. But there's always this piece in the back of your mind, well, is this within the typically developing range? And so I think being willing to have those conversations early and asking, because you might get the response that it comes up probably more often than not that it's confirmation that, yeah, we're just in the normal typically developing range, and we're right on track. And some of the development is just not linear. We're going to have some bumps and bruises along the way, and that's expected. And sometimes having that trusted person starting those conversations early is really important, and leading with those conversations, to what Nestor said. The other thing I'm going to add is that it's one thing about approaching and being willing to be vulnerable with a pediatrician or with a school staff member, but we also have to be curious when one of those people, one of those individuals might say something to us that something to pay attention to. Sometimes as parents, I've experienced this myself, where there's like a natural instinct to get a little bit defensive. A teacher says something like, the behavior wasn't that great this day. You kind of want to get defensive. You want to like protect your kid, but really, more often than not, they're in the best interest of your child as well. And so, just as you might do with a pediatrician or you might do with a teacher, define what it is that they're talking about that they might be concerned about, or how you might track that behavior over a set amount of time and when you want to check back in. Like if a teacher has a concern about your child's behavior, it might be really defining what they mean. Is it that they're not raising their hand? Is it that they're interrupting their peers? So define it tightly, and then think about how you would see that in your setting as well, and then set a time to check back in. And a pediatrician's also going to be pushing for this too, because what they're most interested in is the pattern of the behavior. So if they're identifying a concern or you're identifying a concern, they're likely going to say, let's check back in within this time frame. And here are the ways that we're going to measure or understand whether this is occurring or is improved, so we can really start to get a bead on it.
I love that. I love that, looking for patterns and kind of having that two-way, that bi-directional kind of conversation, and being open to that feedback. Thank you all. I want to take a moment, as this time is flying by, I want to take a moment to remind everyone watching that if you have questions, please add them in the chat. We're also going to be posting resources and information mentioned by our panelists. And anyone joining late or wanting to revisit this conversation, today's Facebook Live will remain available on our social pages afterwards. So I want to kind of talk about next steps. Dr. Parker, you talked about like the assessment, kind of like next steps and being open for assessment. So families seeking support for the first time, that intake or assessment process, being vulnerable and kind of can be a bit intimidating or uncertain. Can you help walk us through what families should expect when first reaching out for support? For example, what should families expect when reaching out for, how can they prepare themselves or their child for that process? What kind of questions should they expect?
Just to clarify, the question is about the interaction with the health system or the school.
Yes, that initial, assessment.
What I would expect is some additional questions. They're going to ask about. They're going to maybe want you to do a screener. They might want to collect some data from additional settings, for example, if you're in a pediatrician's office and you're identifying some behavioral concerns that might be occurring at the school, they're probably going to ask for some rating forms to be completed at the school, or to collect some additional data so that they can have that for their own decision making. I think it's just being willing to be part of the process and involve other people that are interacting with your child, because they have good information too. Lots of care providers do, and I think Jasmine, you mentioned the spaces that our children interact, right? Whether it's in their church, whether it's in their after school, there are a lot of places that have good data points that might be helpful in informing decisions that you want to make, or just to confirm the wait and see, which I think wait and see is not necessarily a bad decision. So it just making sure we've got all the right data on board so we can make good decisions.
Thank you. And then I would also want to follow with that, and everyone can contribute, is how do we, we think about, like, getting that initial assessment, kind of interacting with the provider. As a parent or caregiver, that could feel more comfortable, but to our kiddos, that may be a little uncomfortable. So what can we do as parents and caregivers to really help, comfort and prepare our kiddos for those questions, and help them to feel comfortable about opening up to strangers about some of these feelings or experiences?
The first thing is to remind them that it's confidential. That's a big one. Everything we talk about in the session in the office is confidential, protected by law. So we would get in trouble, the organization, the therapist, the provider, if we were ever to disclose, right, in most circumstances. So that alone is enough to start kind of creating the sense of, like, okay, whatever I say here stays here. I'm of the position that the parent should decide whether a child and youth stays or goes to therapy. I don't think a child has the tools yet to make that decision. Having said that, you do need to negotiate with youth. Like, I'm a therapist, I'm a licensed therapist, and I think every teenager should probably talk to a therapist, by the way, like, just because teenagers, it's hard to be a teenager, right? But every time I used to do an assessment, and in the first intake, we would enter into that negotiation with the child, with the youth, of like, look, I know that you don't want to be here, or I know that you're not sure you need this, but let's make the best of it. And this is what we're going to do. And this is what we're going to talk about. And it's safe. And what are your interests? And sort of creating that connection. A lot of the work that we do initially is also with play therapy. So we'll find, instead of thinking of it as some sort of scientific or sort of overly clinical experience, it's actually just a human experience. And so oftentimes we would just be playing cards and saying, okay, tell me about, what do you like to do? Or there's art that we would start to do, or with little kids, you start doodling with crayons. And that again puts them at ease, makes it relatable, and gives them a sort of a also like a voice in the process. So
yeah, and I will add, I think it's so natural to have the fear that comes with, kind of being part of an intake assessment or initial session. It can feel like a you're behind, you're being evaluated. It can be very exposing, and but also the point is to have a full picture, kind of a holistic picture of the young person and the family dynamic, and getting kids excited, as Nestor said, to share about just their day-to-day and what's going on in their life, and not all the concerns and the challenges, but also, what ends up being the strengths that come through, or what we call protective factors. But those are the things that are really positive that hopefully, the kid is excited to talk about and share about, and really help as we think about what's the right resource and the support for this family, can really lean on the things that are in place that are going to help, really everyone to be successful.
I love that. So I want to transition. So we talk about, reaching out for support, being vulnerable, seeking care, but we also know that sometimes, even when families are ready to engage and get the care for their kiddos that they need, there can be some major barriers. There can be long wait lists. There can be confusing systems. Jasmine, I know that NAMI Chicago works closely with families navigating many of these challenges. And I know everyone on this panel does, but I'm going to start with you on this question. What challenges do you see that families commonly face when trying to access mental health and support, and what recommendations do you have for them navigating the system and getting the care that their kiddos need?
Yeah, absolutely. And I think, some of those also come up as I was talking about, showing up at school or at the pediatrician's office and knowing what questions to ask. Those barriers can surface as well. I think knowing and, want to say on this call that all of us and those of us who do this work day to day are well aware of what the barriers are and want to say that there are people to help you navigate them. And we are working tirelessly try to have the system work better and the way that it is designed to. And within that, there are, in addition to the helpline and 211 and a whole list of resources that are accessible from a variety of different directories and websites. There are things that are in place that are there for folks to start to navigate and to understand, what is available to help them really address those barriers. So I would say NAMI Chicago helpline for sure. The help, our specialists would love to hop on the phone or text and chat. 211 is a really good starting point just to understand what the options are, what's available. There are a lot of sliding scale options. When I talk about kind of like the team-based approach and layering support, knowing that there are wait lists does not mean that support has to be paused. So while you might be on a wait list, maybe you're participating in a support group or exploring a telehealth option if transportation is difficult. Yes, therapy is certainly, something that a lot of people have in part of their plan. And there's some other non-clinical things that might be available now today that are there either to bridge the gap or if you're not quite sure you're ready, a way to start to access support.
Thank you. Nestor or Dr. Parkhurst?
Yeah, this idea of access is a huge sort of challenge. And the reality is, unfortunately, there are wait lists. There's insurance issues or insurance eligibility issues. I said earlier that my job is to create programs. And one of the things that we did to address this issue of access was that while people are waiting on a wait list, we offer a group therapy. So we create a bunch of groups for different ages, different topics, so that the person waiting for an individual provider still could have access to some care and start that sort of process of sharing, if you will. And at the same time, they're getting case management, so identifying what basic needs they might have. A lot of families that we work with have, there's trauma in the family, there's basic needs, issues, or traditionally marginalized, underserved communities. So we're addressing that as they're waiting for the other care. And as you know, the other thing that we created, thanks to your support, is this crisis stabilization unit for youth. And that sounds fancy, but what it really is, and I like to say this, is it's same day therapy or next day therapy. Mm-hmm. So if we find someone is on the wait list that really, for whatever reason, those issues are just really acute and they're just impacting them and the family, we have this space now that you can go, and it's like the living room space, similar to what was described. You can go same day, next day, and start addressing those with professionals who are there to really, make that space safe for you and start that process of healing. So, yeah.
No, I love that. I think that, sometimes when we think about care, we've all talked to, friends and colleagues and about the wait list, or maybe we've even experienced them ourselves, but there are other options out there. And I think that, sometimes it seems like when, the one door has closed, but access to, resources such as living rooms or your crisis stabilization, where you can get that same day care and then potentially get connected to resources. Or Jasmine, you talked about NAMI Chicago, and kind of if you get met with a wait list here, one shouldn't stop and wait for that 3 months, especially when you see like your loved one needing services sooner rather than later. Dr. Parkhurst, I know that you've been working with primary care doctors and pediatricians to address some of this kind of what is really a workforce issue. It's like we don't have enough behavioral health workforce to take care of our residents. Do you have any recommendations for families who are kind of navigating some of that access issues?
Well, in some ways, parents and caregivers are often thrust into the role of being their own care navigator. And they might have a lot stacked against them and many barriers to try and to do that outside of just understanding like the mental health system, which is complex and there might be less information available to it. So, I think about what are the resources available in that primary care space or the place that you're interacting with. I love the idea of the NAMI helpline. But some of our, especially our federally qualified health centers, but most of our, a lot of primary care practices have people that help with care management or peer support. And so I think being willing to ask if they have somebody on their staff that can help connect them or help them address some of the barriers to receiving the care. And the other thing that I like to think about is, given that we all have limited resources, if we have 3 things that we really need to do and 3 priorities, if you will, and what are those priorities? I think asking your care provider that. It's like, okay, if we are trying to address this challenge, what's my order of operations? What are the things that I really need to do first? Should it be really focusing on trying to get psychotherapy aligned? Should we have a stabilization plan because we go in and out of periods of crisis in our house? Should we be focusing on like a family support issue that is really driving this that we're seeing at home? So I like to think about understanding the limited resources and trying to target families after 1, 2, or 3. And you could still use this recommendation of don't just sit there on a wait list, but it can help families orient towards what is like maybe the most primary need. Because what happens invariably is that we get recommendations and we might have 10 people on this recommendation list or 10 organizations, and you call 1 or 2 and you get stuck in a wait list, and it's like you kind of give up.
Yep.
And so trying to really hone down, I think, and be really more specific with families is really important. And so if you have a wait list, asking or you have this list in front of you from your physician's office, who are the 2 that I should call right away? And then what should I do after that? So really kind of crystallizing on what are the 3 steps, recognizing we probably only have time for 1 phone call, and then that list might end up on the back of a car seat, unfortunately, so things to think about.
Yeah, I appreciate that. We started to talk about crisis services. So I really want to take a little time to shift our discussion and focus on those, because many families are unsure of what qualifies as a mental health crisis, when urgent support may be needed, or what resources are available in that time. And I think it's important because families don't always know how to recognize has the situation moved beyond typical stress or emotional distress, and is this something that can wait, or does this require immediate support? So I'd love to start with Jasmine and Esther. What should parents and caregivers know about mental health crisis services, including how to recognize those warning signs that may indicate that this an urgent intervention may be needed, and what steps can they take to assess support during a crisis?
There's some obvious ones. If the individual youth have suicidal thoughts, homicidal thoughts, that's a crisis. Now, whether they end up in a psychiatric hospital or a crisis stabilization or just end up with an appointment to see a therapist, that depends on the case by case and the severity of it. We certainly don't want to normalize any thoughts about hurting yourself or someone else. Another common thing, unfortunately, sometimes it seems like an epidemic, is self-harm. So you'll see, especially youth cutting themselves or hurting themselves. And so maybe they don't express thoughts about dying, but there's this sort of, that's a coping, it's an unhealthy coping mechanism. That's a clear sign of something's not right in terms of their emotional, mental health. Addiction was one of those. So we don't want to normalize that either. And so all those could rise to the level of crisis. And when the schools call us for crisis response, usually it's some sort of acting out behavior or overt aggression, or someone expressed, I don't want to live anymore. But again, we don't have to wait for the crisis. I think you also have, in my experience, kids who shut down and start sort of drifting into this clinical depression, and they tend to be sort of withdrawn and quiet, and so those also should be flagged and looked at. So, but yeah, I mean, it runs the gamut. All those are opportunities to intervene. One of our philosophies with crisis is I know it sounds kind of negative, but the crisis itself, but our philosophy is that crisis is an opportunity for change and growth. So the fact that there is a crisis isn't a bad thing, because now we have a fighting chance to address it and to find out what exactly is under all of that. So there's that to think of.
And not a bad thing. And it also doesn't mean that someone has failed, which sometimes can become a little bit synonymous with crisis. Doesn't mean that the young person has failed, the parent hasn't failed, the treatment system likely hasn't failed. It's just all of the supports that we've been talking about are on a continuum, because our mental health needs change and evolve, and sometimes our needs are more intensive, and so the response has to be more intensive. I echo what Nestor said, though. We don't have to wait until things feel like they really are just, sometimes I think there's a misconception they have to get bad enough for us to access crisis support. And what we're learning with 988 in particular, right, kind of the suicide crisis lifeline, is that 24/7 people can call and text that resource, and we're able to, in that moment, create the stability and the support that is, kind of comes with crisis response. So it doesn't have to be escalated to, emergency and more kind of active rescue, as we term. And so would leave that with families, right? That it don't have to wait for it to get so bad. And there's not like a level of bad, too bad that you have to wait for to access the crisis system. We also, here in our state have our, kind of CARES line, which if there's, mobile crisis is something, we've talked about places that you can go when you're feeling in crisis, and certainly 988 is a number that you can call. And there are also folks who are responding who are not police response, and that's something that we know, unless there isn't kind of a medical emergency or situation going on, oftentimes having behavioral health, peer support response meet you where you are in the community or on the phone to talk you through and see if we can't get to a space where you're able to safety plan and agree to get connected to some of these other levels of support.
And stabilize. Yeah. Thank you. Dr. Parkhurst, any?
I echo what has been said related to the use of 988 and NAMI support line. I think as far as signs and symptoms, I think our ability to have open dialogue really fosters that.
Mm-hmm.
And so so for parents and caregivers, making sure you're creating space to have conversations that aren't just about grades, and not feeling like you got to drag them through conversations. So Jennifer, I think you might have told me this earlier today at some point, where we were talking about the value of a conversation in the car.
Yeah.
Sometimes you got to find those fun opportunities to just check in on what's going on with friends, what's going on with challenges, stresses, things in their life. And maintaining those open connection points are what allows for you to be that person that they come to in their time of crisis.
Yeah, absolutely. It's that continuous engagement, right? You might not get your kiddo to open up at the dinner table, but maybe, as I mentioned, like it's a nighttime ride, down Lakeshore Drive, and where you guys don't have to look at each other in the eye, or it's that kind of, as you tuck them to bed, that another little check-in. I love what I'm hearing from all of you. It's really, that you don't have to wait until things become severe to reach out, that there are resources in the community, whether it's 988, NAMI Chicago, our living rooms, our pediatricians, our counselors, but there's a lot of resources. We talk about the barriers, but there are a lot of resources. And I think one of the things what I'm hearing from you all is like this, don't give up, like advocate, like if you don't find it with the connection with the school counselor, reach out to the pediatrician. If you don't even, don't feel connected to the school, and maybe it's your church community, or maybe it's, reaching out to 988 or NAMI Chicago or in living rooms. But there are resources out there, and families don't have to, do it alone. I know tonight's conversation really highlights some challenges, but I also, again, like hope that it really, reminds people that there are supports to navigate these situations. I would love, maybe for one final question tonight is, when you think of, if you had just one piece of advice or resource or practical step you would encourage families to take, and caregivers to take with their kiddos after tonight's conversation, what would that be? What is it? What, piece of advice, what recommendation, what resource, what step would you recommend? And I'll start with Jasmine because I see her first.
That is such a hard question, which I think is actually like the hope in it, right? That there are some immediate next steps that can happen. I will say, I do think the NAMI Chicago helpline, giving us a call, texting us, saving our number for now or for later is a good step. And the other thing that, we've not talked as much about is just the importance of self-care, right? I mentioned how exhausting advocacy can be. And we also talked about protective factors and, you as parents who love your kid and who are there and invested in their wellness are a protective factor. And so taking care of yourself. So maybe think of one self-care thing that you can do, to help you stay in this.
I love that. We have to practice. We have to model, right? We have to model what we want our kiddos to practice. That's self-care. Thanks, Jasmine. Esther, sorry, and John.
Our vision for behavioral health at ADS McKinley is to help individuals and families achieve the healthiest version of themselves. And when you ask yourself that, it could be, some days it could be you got out of bed, other days it could be, it varies, right? And from child to parent. But I love this what you just said about mentoring and modeling it. Like, I think the healthiest thing you could do as a parent is to be as honest as possible with your children, to not have taboo subjects, meaning that you said earlier, have these ongoing open discussions. Because if you don't open yourself to those conversations, usually youth will have those conversations somewhere else in a less safe space, getting different kinds of advice, right? So you don't have to make anything taboo and just have these calm ongoing conversations. And at the end, really what everyone wants, including us, I think we never outgrow this, is we just want to be listened to and validated. That's really what therapy is. When I used to do therapy more on the regular, I would say that whoever's sitting in front of me is the most important person in the world for that hour, because they're getting my full attention, my full, And so if a parent could model some of that you're going to create the healthiest environment for yourself and for your family. So yeah.
That's really powerful. I think everybody, whether you're a kiddo or an adult, wants to be seen and heard.
Correct.
Yeah, thank you. Last but not least, Dr. Parkhurst.
Yeah. I think the theme here is that while there are barriers to resources, there are also resources, and we can get stymied or set back by access points. But I think what parents and caregivers know is that when there is something that they are concerned about, they need to be able to step in. I mean, it may not be it may be this nagging thought that there's a concern, but being willing to step up and say something to a person who can help, like a pediatrician, somebody trusted at school or in their community. I think that's the place to start. I don't know if it's bigger than that. It's being willing to kind of bring to the attention what needs to be attended to.
Having that vulnerability, speaking up and advocating. Well, thank you all so very much for your expertise and your compassion and wisdom for tonight's conversation. I also want to thank everyone who joined us. We know that, navigating these mental health services and just kiddos' mental health and well-being is not always linear. It is not always easy. But gosh, is it worth it? That return on investment. And I hope that everyone leaves here knowing that there are people, organizations, and supports available to help and to just not, as Dr. Parker said, and we've heard from Jasmine and Nestor, is to reach out. Don't sit with it. This is not that we are. I mentioned this the other day. Like it's that cliche, but it's so true. It takes a village. You know what I mean? And so we are not meant to do this alone. And so to reach out and ask for help. I really hope that those who are listening have felt that and are more hopeful and will reach out and ask for help. So thank you all so very much. I hope everyone listening has a wonderful evening. Good night.